Thank you all for joining us for the National Health Service Corps Loan Repayment and Scholarship Programs Opportunities for MD and DO medical students and physicians. I'd like to highlight a couple housekeeping items for you in Zoom. The features available to you can be found at the bottom of your screen. While the chat button is disabled, we will be posting links and resources in the chat, so you'll be able to download that throughout the presentation. If you have any questions today, we're asking that you please use the Q&A pod, once again, located at the bottom of the screen. Please note, not all questions will be answered in the order in which they received, and we will go over the questions after the presentations today. Thank you again for joining us, and we hope that you find today's webinar incredibly helpful. Now, I'd like to turn things over to Sharon Sanders. Sharon?
Hi, good morning, good afternoon, and welcome to the National Health Service Corps webinar for MD-DOs, medical students, health centers, and primary care associations. My name is Sharon Saunders, and I'm a public affairs specialist with the Bureau of Health Workforce, which is part of the Health Resources and Services Administration, often called HRSA. Today, during this one-hour webinar, we will provide information on loan repayment and scholarship programs that help clinicians and students reduce or eliminate medical school debt. Next slide. We are co-hosting this webinar today, and we're very pleased to have the American Medical Association and the American Osteopathic Association, as well as the National Association for Community Health Centers joining us. We're grateful to each of you for your support and your assistance in promoting this webinar to your members. Next slide. So we have a packed agenda today. In addition to our AMA and AOA co-hosts, as well as with NAC, we'll hear from National Health Service Corps program experts. Dr. Mahi Varma is a public health analyst within the National Health Service Corps, and Kelly Duke is a regional analyst with our regional operations. Together, they will review eligibility, share information about the application process, and respond to questions. Please be sure, as you've heard earlier, to use the Q&A pod to submit your questions so that we can respond efficiently. Finally, you'll hear from two physicians. They've benefited from these programs, and they're eager to share their impact that the programs have had on their professional as well as their personal lives. So in the interest of time, let's dive right in. Let's go to the next slide. And I'm honored to introduce our esteemed presenters who will provide opening remarks. Dr. Sanjay Desai, Chief Academic Officer of the American Medical Association, Dr. Ira P. Monka, President of the American Osteopathic Association, and Dr. Donald L. Weaver, Advisor to the National Association of Community Health Centers. Please keep an eye on the chat box. Our HRSA team has put a link to each of our presenters' bios there. So you can find out more information about each of our co-hosts, and then you can also check out the relevant links that we'll be dropping throughout the program. Without further ado, Dr. Sanjay Desai, the floor is yours.
Thank you so much, Sharon. It's a pleasure to be here, and I want to thank everyone at HRSA for this incredible program that's had such impact on our country. The American Medical Association works tirelessly to ensure health access and coverage for Americans across the nation, especially for the country's most vulnerable patient populations. And there's a need for more physicians to close existing gaps in primary care health professional shortage areas in particular. And on top of that, experts predict that there will be about 25% fewer rural physicians practicing by the end of this decade. And it's already estimated there are more than 83 million people in the US that live in areas without sufficient access to primary care. So to improve health access in rural and underserved areas, the AMA is urging Congress to create a more sustainable Medicare payment system, to boost our physician workforce, and to support innovation in approaches to care. Part of this mission is to address school debt. The high cost of medical school remains a major barrier for those looking to become physicians, particularly those from minoritized and marginalized communities. Average medical student debt is around $200,000, and underrepresented populations of physicians tend to have higher debt levels. In general, reducing medical student indebtedness promotes diversity within medicine and may lead to an increase in the primary care physician workforce, as well as other undersupplied specialties. And programs such as the NHSC are crucial to helping relieve physicians of this medical student debt. Since minority students are more likely to enter primary care than their white counterparts, the immense debt burden of medical school not only precludes diversity amongst physicians, but also has limited the potential of primary care physicians and thus diminished the improvement of patient care in underserved communities. With recent healthcare reform seeking to eliminate healthcare disparities in the U.S. population, increasing the number of historically underrepresented physicians is important to ensure a healthcare workforce that is more reflective of our general population. So the AMA has advocated for and will continue to advocate for additional funding for the NHSC and to help booster and bolster the scholarship aspect of the program. And the AMA has advocated that the NHSC also be expanded to include more scholarships, greater loan forgiveness, and the inclusion of all medical specialties in need. So we believe that the NHSC needs more primary care physicians applying for its programs, and we encourage all of our members to please consider this. And again, our gratitude for all the work that you do. And I'm going to pass it on to Dr. Manka.
Thank you, Sanjay. I appreciate that. Thank you. Welcome, everyone, this afternoon. Thank you for joining this important informational webinar and question and answer session. And thanks to the Health Resources and Service Administration for inviting the AOA to co-host this webinar by the National Health Service Corps on scholarships and loan repayment programs, followed by a question and answer session for physicians. The AOA has supported the National Health Service Corps for many years in promoting important work to increase access to quality healthcare in communities with significant health professional shortages. The National Health Service Corps supports more than 18,000 primary care medical, dental, and behavioral health providers through their scholarships and loan repayment programs in more than 8,400 community health centers and facilities. Because the National Health Service Corps connects primary healthcare clinicians to patients with limited access to healthcare, their programs align well with the osteopathic medicine philosophy and mission, with over 57% of the osteopathic physicians choosing primary care and working in underserved areas throughout this country. As a leader of national organizations representing more than 186,000 osteopathic physicians and students, the American Osteopathic Association encourages you to consider reviewing the loan repayment and scholarship programs offered through the National Health Service Corps. It can help with eliminating school debt, provide you with an opportunity to serve patients and communities in need of quality health care throughout the rural parts of this country. Enjoy this webinar and be sure to stick around for the question and answer period that will follow later. And we hope to have an engaging discussion and session to follow. Again, thank you very much for this opportunity and look forward to this meeting this afternoon.
Thank you, Dr. Manka. Let me tell you a little bit about the National Association of Community Health Centers in general, and why the partnership with the National Health Service Corps is vital to meeting the healthcare needs of underserved communities. NAC serves as a national voice for community health centers, the nation's largest primary care network. 31.5 million people, 1 in 11 in the United States, are served by health centers. At over 15,000 delivery sites in frontier, rural, and urban America, nonprofit, patient-driven community health centers provide high-quality, comprehensive health care to America's medically underserved communities, serve all patients regardless of income or insurance status, and are governed by community boards to ensure a response to local needs. NAC is committed to improving the health of underserved communities and vulnerable populations and achieving the quintuple aim: equity, improved patient experience, improved health outcomes, improved staff experience, and reduced costs. And you cannot achieve these aims without a skilled, mission-driven workforce committed to equity and social justice. National Health Service Corps clinicians and alums serve as key members and leaders of health center care teams across this great land of ours. The National Health Service Corps is an invaluable resource in the retention and recruitment of clinical team members for health centers, and NAC is committed to working with the NHSC to assure that all members of the health center movement are aware of the opportunities available through the National Health Service Corps. This audience includes health center clinicians and leaders, students, state and regional primary care associations, and other national, regional, and state partners. In summary, the National Health Service Corps is an essential workforce partner with NAC in achieving our mission. Sharon?
Thank you. Thank you, Doctors Desai, Monka, and Weaver for joining us today. We truly appreciate your commitment to sharing these programs with your members. Next slide, please. Now we'd like to transition to our National Health Service Corps presenters. So over to you, Dr. Varma.
Thank you, Sharon. Good afternoon, everyone. My name is Mahi Varma, and I'm a public health analyst at National Health Service Corps, a division within HRSA. This webinar is designed to provide you with a high-level view of all of our National Health Service programs for students, for clinicians, and for sites. Next slide, please. The mission of NHSC is to build healthy communities by providing financial awards to primary care providers committed to serving in the nation's high-need rural and tribal areas. The National Health Service Corps includes both scholarship programs and loan repayment programs, which we will cover in greater detail during this webinar. The program's field strength is more than 18,000 primary care medical, dental, and mental health care providers, dedicated to serving over 19 million patients in underserved communities. The NHSC continuously expands and adapts its clinician support to address public health crises that directly related to its mission to provide quality primary, medical, dental, and behavioral health care. The National Health Service Corps includes both scholarship programs and loan repayment programs, which we will cover in greater detail during this webinar. Next slide, please. The National Health Service Corps, also known as the NHSC for short, it is one of HRSA's funded programs that is administered by the Bureau of Health Workforce. It is the Bureau's primary resource for addressing the maldistribution of healthcare providers across the nation. Here on this chart is a side-by-side comparison of all NHSC programs. Our two-year traditional loan repayment program, then we have the substance use disorder loan repayment program, and the rural communities loan repayment program. On the right-hand side, you will find our scholarship program, our student to service program, and our state loan repayment program. I will be going over these programs in more detail. Next slide, please. The NHSC has four recruitment and retention methods that are committed to identifying a skilled primary care workforce and placing them in areas where they are needed most. As you may be aware, our loan repayment program allows sites and communities to expedite the recruitment or retention of skilled providers. Here you can see in fiscal year 2023, the NHSC loan repayment program received over 9,000 applications and nearly 7,000 applicants. On the far right of the slide is our second largest program, the scholarship program, with over 2,900 applications received and 180 awards. Recipients from the scholarship program are eligible to apply for the NHSC's loan repayment program if they have remaining eligible educational debt and continue to work at an NHSC approved site. You will see two other NHSC programs in the middle. Our student to service program, also known as S2S, serves as a hybrid to both the scholarship and loan repayment program. This program provides a direct connection to the pipeline of clinicians like the scholarship program. The S2S loan repayment program provides up to $120,000 to medical or dental students in their final year of school in return of 3 years of full-time or 6 years of half-time NHSC service commitment. Finally, our state loan repayment is a grant program that partners with over 40 states to provide their own loan repayment program. For states to participate in this program, they are required a dollar-to-dollar match of funds from each state. And in 2022, we have made awards to 46 states plus DC and 3 US territories. Next slide, please. Okay, let's review some of the programs that we offer for students pursuing careers in primary healthcare. Next slide, please. Our NHSC scholarship program just opened and is accepting applications until April 25, 2024. For our scholarship program eligibility requirements, the NHSC scholarship program applicants must be U.S. citizen or U.S. national. Full-time students must be enrolled or accepted to a fully accredited school by September 30th, located in a state, the District of Columbia, or a U.S. territory, for any of the following programs: physician, MD or DO, dentist, DDS or DMD, nurse practitioner, certified nurse midwife, physician assistants. Students are eligible to apply during any academic year of their enrolled healthcare program. For more information, please visit the link posted on the slide. Next slide, please. For our Students to Service Loan Repayment Program, please note, to be eligible for the program, you must be a U.S. citizen or a U.S. national. This program is for students who are in their final year of school pursuing a degree in medicine as a physician, or in dentistry, or in nursing. Please note the postgraduate training requirements. For physicians, you must complete an accredited primary medical care residency in an approved specialty: internal medicine, family practice, pediatrics, OBGYN, psychiatry, and geriatrics. For dentists, they're encouraged but not required to complete an accredited postgraduate training in an approved specialty: general practice, advanced education in general dentistry, pediatric dentistry, public health dentistry, and geriatric dentistry fellowships. Nurse practitioner, certified nurse midwives, and physician assistants are encouraged but not required to complete an accredited postgraduate training in an approved specialty: a 1-year postgraduate training in primary care facility. Next slide, please. New for 2024 is the Maternity Care Target Area Award Enhancement, which offers up to an additional $40,000 of eligible loan repayment award to eligible discipline. The discipline and specialty combination eligible for this optional enhancement are family practice physicians with OB specialty, physicians with OBGYN specialty, and certified nurse midwives. To be eligible for this optional enhancement, you must be awarded to Students to Service Loan Repayment Program within one of the eligible discipline and specialty combinations. After the Student to Service Loan Repayment Program contract is countersigned, those eligible participants will be offered the optional Maternity Care Target Area Award Enhancement Addendum. This enhancement awards up to additional $40,000 of eligible loan repayment funds for a maximum award up to $160,000. Eligible participants who sign the addendum will have a change in their service requirement. Instead of having to fulfill the service obligation in health professional shortage area with a minimum score of 14, the addendum requires service in maternity care target area with a minimum score of 16. Next slide, please. Prospective scholarship applicants should be certain that primary care is their final practice destination before they apply. If you are unsure if primary care is the ultimate career goal at this time, we have other programs such as the Student to Service Loan Repayment Program, or as a licensed clinician, you can apply to one of the NHSC loan repayment programs. Next slide, please. Next slide, please. Here's what's new for fiscal year 2024. The National Health Service Corps Loan Repayment Program aims to address language access barriers to healthcare, which will provide a one-time Spanish language award enhancement of up to $5,000 for a total repayment award up to $55,000 for providers not working in a primary care HPSA, and up to $80,000 for providers working in a primary care HPSA. This award enhancement will be afforded to providers who demonstrate Spanish language proficiency through an assessment administered by General Services Administration approved vendor, and whose site confirms that the applicants will provide Spanish-speaking services to limited English proficiency. For providers working only in primary care HPSA, can receive up to $80,000 for a full-time contract, which is a combination of the Spanish language award enhancement if applicable. Half-time clinicians can receive up to $42,500, which is also a combination of the Spanish award enhancement. also if applicable. Please note that if you're not eligible for the one-time Spanish award enhancement, then the award amount would be up to $75,000 for a full-time contract and up to $37,500 for a half-time contract if working in a primary care HIPSA. Also here, the National Health Service Corps received an extension of $345 million through December 31, 2024. Next slide, please. All NHSC applicants must be United States citizen or national. They must be trained and licensed in eligible disciplines approved by National Health Service Corps. They must be licensed to practice in the state where they have obtained their professional licenses, unless they're working at a federal prison, Indian Health Service facility, or a tribal site. Applicants working at any of those facilities can be licensed in any state. Here we have a comprehensive list of eligible disciplines across our 3 loan repayment programs. I want to point out that we have only listed disciplines that are eligible for all 3 loan repayment programs. If you are an RN or a pharmacist, then you are eligible for our substance use disorder and rural community loan repayment program. If you're a substance use disorder counselor or a certified nurse anesthetist, then you're eligible to apply for our rural community loan repayment program. Next slide, please. For our 2-year traditional program, awardees can receive up to $50,000 for a full-time NHSC contract and up to $25,000 for a half-time NHSC contract. However, if working in a primary care HIPSA, awardees can receive up to $75,000 for a full-time contract and up to $37,500 for a half-time NHSC contract. Awards are prioritized to applicants who work at NHSC-approved sites with the highest need. The highest need is defined by a health professional shortage area score, better known as HIPSAs. The 2-year program also offers the opportunity for clinicians to apply for a continuation contract after completing their initial 2-year service commitment and providing they still have eligible outstanding education loans. In addition to receiving loan repayment, providers receive a competitive salary from their employers. Please note that employers cannot count the NHSC award funds as salary. Next slide, please. As part of the HHS's response to the opioid epidemic, we have 2 NHSC programs that focus on expanding and improving access to quality opioid and substance use disorder treatment in underserved areas nationwide. Healthcare clinicians qualified to provide substance use disorder treatments may receive student loan repayment in return for their service at NHSC-approved sites. Applicants from NHSC-approved sub-treatment facility may receive priority if they serve an opioid treatment program or are certified in substance use disorder interventions, such as master's level substance use disorder counselors. The SUD program offers up to $75,000 for a 3-year of full-time service obligation and up to $37,000 or $37,500 for 3 years of half-time service obligation. Unlike the 2-year loan repayment program, the SUD program does not offer a continuation contract. All applicants must be trained and licensed to provide SUD treatment at an NHSC-approved SUD treatment facility. Next slide, please. The Rural Community Loan Repayment Program is like the SUD program. However, clinicians must be trained and licensed to provide SUD treatment at an NHSC-approved rural SUD treatment facility. Also, like the SUD program, applicants in the Rural Community Program are not eligible for a continuation contract. The award amount for Rural Community Program is up to $100,000 for a 3-year service commitment and up to $50,000 for a 3-year half-time service commitment. Please note that the SUD program and the Rural Community Programs do not offer loan repayment for dentists and dental hygienists. Priority is also given to applicants currently providing care in an opioid treatment program at an NHSC-approved site or who have license or certification in substance use disorder interventions, such as master's level substance use disorder counselors. Next slide, please. Throughout the service obligation, all NHSC participants are required to verify their employment at any time spent away from practice every 6 months. You must document your vacation, sick leave, federal holidays, clinic closures, and any other time spent away from your site with NHSC. Full-time contract status is 40 hours per week, includes patient care, admin duties, teaching hours, and telemedicine. As far as allotted hours to account for administrative duties, teaching hours, or telemedicine, the requirements vary by discipline. So please consult the application and program guidance for additional clarification. This concludes my brief overview of the NHSC programs. I will turn it over to Ms. Kelly Duke from the Division of Regional Operation, Kansas City Region, who will go over the next portion of the presentation. Next slide, please.
Thank you, Mahi. Hi, I'm Kelly Duke. I am with the Division of Regional Operations and am located in the Kansas City office. We work directly with National Health Service Corps participants and with sites, and that's what I will be reviewing this afternoon. Next slide, please. So, National Health Service Corps approved sites. Clinicians can serve at approved sites across the nation and U.S. territories. Approved sites are outpatient facilities providing primary care, medical, dental, and/or mental and behavioral health services. The facility can be located in a rural, urban, or tribal community. There's a conception that they can only work in rural areas, and that's not true. There's a lot of different locations you can work at. And to apply to become a National Health Service Corps site, the facility must be an eligible site type, which we'll look at next, and meet applicable requirements. Next slide, please. There are a lot of different National Health Service Corps eligible site types. One of the most common are our federally qualified health centers, such as community health centers, migrant health, homeless programs, housing programs, school-based health clinics, and mobile clinics. FQHC lookalikes are allowed. Indian Health Service facilities, certified rural health clinics, correctional and detention facilities. However, those do need to be federal or state. Critical access hospitals, state and local health departments, community outpatient facilities, and those can be hospital affiliated or non-hospital affiliated. Private practices, solo or group, school-based clinics, mobile clinics, free clinics, and SUD treatment facilities. Next slide. For eligible auto-approved National Health Service Corps sites, they can submit an application to be an eligible site at any point during the year, and they are not required to submit a recertification application every 3 years. For auto-approved National Health Service Corps sites with multiple eligible sites, each location must submit its own application. For non-auto-approved sites, they do have to submit a recertification application every 3 years, which are reviewed by DRO analysts such as myself. Next slide. We have 10 regional offices across the country. Again, I'm in Region 7, which is located in Kansas City. We have staff in each region that are available to help you, and you can find a list of us at the link on the slide. Next slide, please. Support and resources. We're going to talk just a little bit about the Health Workforce Connector. Next slide. The Health Workforce Connector is a really useful tool. Clinicians can create profiles. That profile will allow you to view job vacancies at thousands of National Health Service Corps and Nurse Corps approved sites nationwide. And the Workforce Connector lets primary, medical, dental, and behavioral health job seekers create a free profile. So once you create, well, even if you don't create a profile, you can look at sites across the country and see what their HPSA score is and if they're hiring. Next slide, please. The Workforce Connector has site profiles for all approved National Health Service Corps and Nurse Corps sites. These sites can post job vacancies, which are visible to thousands of healthcare professionals. Each site profile contains job vacancies, the HPSA score, and which programs they are participating in. So really useful tool for both sites and providers to link up and see what's available in areas that you're interested in. And that's it for me. So I'm going to turn it back over to Sharon. Thank you very much.
Thank you so very much, Dr. Varma, Ms. Duke. Both very informative presentations, so helpful. So we are going to continue with our program, but I just wanted to make a note that we've got a couple of questions that have come in through the Q&A pod. I think that's fantastic. Please continue to submit those questions. Some of them we'll be answering directly via text, and others we're going to respond to verbally during our Q&A session, but we will answer those questions. So our next slide is part of our final section, which will involve 2 NHSC awardees. Joining us today, they're going to be sharing their stories, and that's Dr. Aaron Anderson and Dr. Mark Daywalker. First, I'd like to turn the floor over to Dr. Anderson, and then Dr. Anderson, after you share your story, if you could please pass the torch to Dr. Daywalker. Thank you.
Good afternoon, everybody. It's a pleasure to be able to speak to you and to share a little bit about my story with you through the NHSC. You've heard a lot of great information so far, but I hope to be able to help you picture what it might be like to serve at some point as an NHSC scholar or loan repayment recipient. It's really exciting to me to also see that NHSC continues to evolve and has come up with programs like the Spanish aptitude test to help people get credit for the Spanish that they speak, or maternal health services and substance use disorders. There's a lot of interesting programs that have been developed to get providers and physicians like you into these places, even since I started with the program. So a little bit about me. I'll tell you about my site in a few minutes, but basically I work in central Washington State. I work in an agricultural area and at an FQHC in the town of Toppenish. A lot of the apples, pears, cherries, hops, grapes that you may see around the country are grown in this area. A lot of seasonal farm workers work here. Used to be the migrant stream that would come up from Mexico, and now most folks that work in the area are seasonal farm workers. I first learned about the NHSC program when I was working at a community health center in a small town in Oregon. I worked with the migrant farm workers and seasonal farm workers, and a few of the physicians that I worked with encouraged me to consider applying as I was applying to medical school to be a part of the NHSC program. I knew I wanted to do primary care, and with my experience working with the migrant farm worker population at the time, I really fell in love with community health center work, and I would love to continue to pursue that type of career. In the Dalles at the time, folks would come up from Mexico and pick the cherries, for example. We would go out to the camps and let them know about some free clinics that were offered. Some of the folks that came into the clinics had never seen a provider or a doctor before. And then I remember being excited as I interviewed in Seattle a number of years ago about the prospect of having my school and debt paid for and not having to shoulder that burden, which can be pretty significant. It was a lot when I went to school, and it's even more since then. So I understand that burden that many of you face. Currently, I've been in practice now for 15 years at my FQHC site. 4 years, did my 4-year scholarship program, and then I did 2 years of loan repayment afterwards. And I'm still here. I really love the population that I get to work with. I have a patient panel of around 1,200 people. Most of these are older, more complex individuals since I'm an internal medicine primary care doctor, and about 70% are Spanish speaking only. One thing that stands out to me is that the group of patients that I care for are extremely appreciative. So it's almost every day that I hear, thank you for seeing me, I really appreciate your help, or actually my wife does not have a doctor right now, so would you mind maybe taking her on? With working at an FQHC and in some of these environments with high HPSA scores, there are definitely challenges. I see the effects of poverty around me every day. I just saw in the newspaper, the town that I work in Toppenish, the annual individual income is about $24,000. Transportation issues are a real barrier for some of our folks. I may have a 75-year-old female that needs physical therapy that I'm taking care of, and she has no ride. All her family members work, and so transportation. We don't have bus systems. We don't have subways. We don't have other transportation systems in rural Washington. So those can be challenging at times. And then it's not uncommon to have a patient express a small token of appreciation with something like a watermelon. I have one gal who has a green thumb, and around July or August, she brings in these watermelons that are probably 35 pounds. My daughter could barely lift it up. She brings me her watermelons. I had another patient where on the way out the door, he said, hey, can I borrow a garbage bag? And so I gave him a garbage bag, and he returned about 15 minutes later with a large salmon that he had caught on the Columbia. Being part of the National Service Corps and working in an environment like I have within my clinic system has really allowed me to grow in different areas of leadership. I'm currently the chair of the Evidence-Based Guidelines Committee. We're an interdisciplinary group, and we review things from diabetes to obesity management to hypertension, ASCVD risk, and provide guidelines to our organization. And we affect around 180,000 patient lives through this. So we're one of the largest FQHCs in the country, and throughout Oregon and Washington, we take care of around 180,000 patients. I've also been chair of the Controlled Substance Oversight Committee. I'm happy to see the NHSC helping try to address the opioid epidemic and other issues that continue to plague our country through trying to find the right people to address substance use disorders. And I prescribe some of the medication for MAT treatment as well to our community. I also really value the opportunities that I've had for medical education. I take third-year medical students. It's not uncommon to I almost always have somebody with me during the course of my day from Pacific Northwest University or Washington State University, and they really glean a lot from seeing these patients at our clinic. So some final thoughts. I am very appreciative for the National Service Corps. It's allowed me to practice in a community and an environment that might have been very difficult for me to practice in if it was all on my own. So it has been a great partner to me. I see that there's forward thinking with the organization and placing individuals that care, like yourselves, into parts of the country, both urban and rural, where there's definitely large needs. I am excited to be part of the National Advisory Committee, or National Advisory Council, and I just had a meeting yesterday and today that I have to get back on here pretty soon with, but we're able to see what's going on around the country and to try to give input into how to better serve these communities that NHSC touches. So that's my story, and I will hand it over to Dr. Daywalker here.
Thank you so much, Dr. Anderson. So good afternoon, everyone. My name is Dr. Mark Daywalker. I currently serve as the Chief Health Equity and Wellness Officer at my community health center, which is Access Health. We're principally located right outside of Houston. We see patients in the Fort Bend and Waller communities. Just to give you a little bit of an idea in terms of scope for our community health center, we are considered an FQHC, fairly qualified health center. And we have a total of 13 locations, 8 of which are clinical, 5 of which are non-clinical. We take care of a little over 20,000 patients. My patient panel at its peak was around 2,000 patients. With the transition in my status within the organization, I'm starting to do some integrated shared medical appointments, which I'll talk about a little bit later, maybe here we have a little time. But I'm really excited. I was really excited to meet Wendy, who actually organized all of this and sent me an email to be a part of this really prestigious panel of folks that we have here to kind of talk to you guys about the wonderful things that HRSA is doing through NHSC. So it's an amazing opportunities within community health center space, and that's really what I want to kind of dig into. But I'll start with a little bit of my background here to kind of let you guys know where I was at as a student, kind of where you guys are now. So I did attend Morehouse School of Medicine in Atlanta, Georgia. And for those of you that know, Morehouse is really big on the social mission to really address those social drivers and determinants of health. So that really gave me my initial lens of having that heart for community medicine, kind of looking at that public health approach to direct patient care. And I learned about the NHSC Students to Service Award from a fellow medical student. I kind of already knew about community health centers because my family, we actually utilize a community health center back home, which is Vidalia for me. So I was really, really excited to learn more about it. And really what it did for me is it really connected passion to purpose. I knew that I had a heart to kind of want to give back to marginalized and underserved communities. So that really checked that box for me in such a way that it lifted a little bit of a burden when it came around time to really match for residency. But it also helped me in that I was able to match into a place, a setting that really mirrored what populations that community health centers really take care of. And you can see here on the screen here, it was UTMB. And working with underserved patients kind of gave me that idea of what I would be experiencing as an attending. The other really neat thing for you guys to kind of think about in terms of residency, and one of the things that I really took to heart and really think about those other unique factors that may help you as an attending. In particular at UTMB, they also had integrative and behavioral medicine, which I also got trained in as well, which really kind of has helped me within my practice and a lot of the other opportunities that I'm going to talk to you about that you can experience if you want to within the community health center space. Another really great thing with especially the community health center space is that we have something called primary care associations, which kind of do the training as well as the technical assistance for the community health centers in their particular state. So I was able to connect with a recruiter to kind of help me along my way and path to find a site. If you guys are interested in hearing more about that, I'm happy to talk a little bit more about that. So in terms of my site experience, it was both rewarding as well as challenging. I want to make it really personal for you guys because this is exactly what you guys are going to have to deal with as you kind of pursue medicine in the areas that we kind of take care of. But for me and my story, coming right out of residency, I was a newlywed, a new father, and I actually graduated right before the pandemic. So as you can imagine, that was a lot of new changes for me. Going back to the ideal about the primary care association, one of the really neat things about community health centers is that we're really big on innovation, driving innovation in spaces to meet our unique populations and their needs. So we were doing something called trauma-informed care and an organizational transformation for that. So I was able to kind of latch onto that, and during the time of the pandemic, was able to support our staff health and well-being. And that kind of led to my first promotion within the organization and become a director. So just to speak back to Dr. Anderson's point, there's a lot of opportunity for leadership and growth in these spaces because community health centers is just that hotbed for it. So to fast forward a little bit from that standpoint, after completing my 3 years, which is the students to service requirement for full-time, paying back the full-time employment, I had a really, really neat opportunity to work with the Association for Clinicians for the Underserved doing a workshop. And that's actually where they held the NHSC 50th ball, 50-year anniversary ball. And I got to meet some really, really neat people and understand what it took to really get this award up and going, and the millions of lives that's been touched by it is really, really amazing. So in terms of future next steps for me personally, even having completed and now being an alumnus of the NHSC award, I certainly, as I am now, would love to continue to work in the community health center space. I'm actually doing some work with the Texas PCA. I'm one of the board members for our clinical committee. I'm also serving as faculty and a coach for NOAA, which is the National Network of Oral Health Access, which essentially is the dental version of what ACU does in terms of the training and technical assistance to support our community health centers across the nation. Also part of the ACU, again, which is the Association for Clinicians Underserved JEDI Committee. And just some general tips for you guys in terms of applying. Just keep up the really the heart connected to the work. So remain enthusiastic and optimistic in the face of some of the challenges that you may have, because they will happen in life. But what I think the community health center space really allows us to do is grow, right? Whether you just want to continue to see patients on the attending level, whether you want to start doing some things around workforce development, whether you're interested in things like research, leadership, quality improvement, there's always advocacy. There's always different things that you can kind of tap into, and I'm happy to talk to you more about those different things. But I think that's my time. I'll pass it back to you, Sharon.
Thank you. Thank you so much, Dr. Anderson and Dr. Daywalker. Your stories are just so compelling. We appreciate you taking the time out today to share them with us, and wish you continued success. So please, feel free if you're able to stay on for our Q&A session. We'd love to hear from you, but if you have to drop off, that's totally understandable. But before we do get to the Q&A, let me share on the screen some support and resources and how you can get in touch with us around these programs. We are getting a lot of great questions coming in, but I imagine as things happen, you may have more after the webinar. So this is one way that you can reach out to us is through our customer care center. We have an 800 number that's available Monday through Friday, 8 a.m. to 8 p.m. Eastern time. So you can call and get your questions answered there. You can also research and get some information from our websites. So we have our National Health Service Corps website. We also have a virtual job fair webinar or virtual job fair webinar site. We have those several times a year. And then we have our Health Workforce Connector, which is helps you look at the existing opportunities that are out there for you. We've dropped those links in the chat, and also have dropped the links to our social media sites on Facebook, X, as well as LinkedIn. So all that information is there for you. We highly encourage you to follow our social media sites and keep up with what we're doing. But another way to do that is to stay connected with us by taking your phone out and capturing the QR code that's on the screen. So these applications for these programs that we talked about today, they're opening and they're accepting applications each year on an annual basis, but the dates always vary. So you don't want to miss anything. If you scan the code, you'll be taken to our email subscription page where you're going to be able to sign up for notifications so that you can get a direct email inbox message letting you know when these programs are opening, and you won't miss anything. So I'll give you a moment to do that if you haven't done that yet. Okay. So, and if you did miss capturing that QR code, we've dropped a link in the chat, or we will be dropping a link in the chat that you can also click on, and you can access it that way. So it's time for our Q&A. We've had over 13 questions already answered. In the Q&A pod, you can check the answered tab to see what questions have already been answered. Maybe your question has already been asked and answered. But let's continue to see if you all have questions that you'd like to submit, and we'll get started responding to those. We've got a couple that are being answered right now. And I may call on someone verbally to respond to a question that's just been posted. Okay, so the question is about inpatient care. Would inpatient care within the approved specialties work with the NHSC scholarship requirements, or is it only outpatient care that is approved? So I'm going to toss that over to our program folks. Anyone who would like to respond?
Okay, I'm not sure if Sabrina is on still, but for the National Health Service Corps loan repayment program, we only allow for outpatient care, not inpatient. The only inpatient is if you're working at an IHS hospital, but you must have outpatient facility with that.
I might just add that I think if there's some inpatient that's involved and it's not the majority, sometimes there's cases where that works. When I started my job, the first 3 years I took call at the hospital for internal medicine patients at the hospital, and that was part of my NHSC agreement. However, inpatient only would not work, and it's become more and more rare, depending on how rural of a site you're at, that you do both. You do both the inpatient and the outpatient, unless you're in an academic type situation. But it's become increasingly separated over the years in terms of hospitalist medicine versus outpatient medicine.
I just want to add to that. If you like OBGYNs or certified nurse midwives, you do have a percentage of time where you actually work inside a hospital. So that's
Right.
considered inpatient.
Thank you so much. This question's for Dr. Daywalker, or sorry, Dr. Anderson. How did the NHSC funding, if it did help with your personal goals? I think we might have heard a little bit about that from Dr. Daywalker, but just your personal goals, how having that funding, tell us a little bit more about that. Thank you.
I think in my bio, I grew up in South America for part of my life, and I saw, firsthand the need for wanting to do something to make a difference in the world. And so I also developed that heart for wanting to serve in a medically underserved area, and NHSC helped provide that. Now, in terms of my family, we had 2 kids when I was in medical training. My wife is also a physician. She's running a plant nursery now, though, so she's doing something completely different from medicine. But she was a year behind me in school. She also received a scholarship, but we decided to forego her scholarship because for NHSC, because we couldn't be guaranteed that we'd be placed in the same location. And so 2 kids during training on the East Coast. When we looked at sites around the country and the territories, this was coming back closer to home. We had family a couple hours away. And after being away for quite a while, it made sense for us to be here. Then we had 2 more kids here. So been able to raise a family. It's an area that we really love of Central Washington. There are lots of outdoor opportunities. Going to go rock climbing and hiking and all the outdoor things on the weekends when I have a day off. So personally, it's been a very satisfying place to land.
I appreciate you sharing that with us. Okay, I think we're still answering some questions. Let's see. We have a question for Ms. Kelly Duke. I think this would be for you. As an FQHC rep, Federally Qualified Health Center representative, how can I update our Health Workforce Connector profiles to attract candidates? How can I work with HRSA to keep up-to-date HPSA scores?
Yeah, actually, I was just answering that. I was going to answer it in the pod. We have a link to a site POC user guide, and that will walk you through every aspect of how to update your site profile. Regarding your HPSA scores, those are done automatically in partnership with the state primary care office. If you have additional questions about the HPSA score issue, contact me offline. It'll be easier to do it that way than getting into a HPSA score discussion online. But I will put the link to the POC user guide in the chat.
Thank you. And if we can also drop in the chat the email address for our stakeholder mailbox, then you can send your message directly there. And we can also do that follow-up. Thank you. So we have another question. I'm going to just read it verbatim. Just to clarify, if we are in our last year of medical school, so incoming resident for this upcoming June, July, would we be able to apply or qualify for the rural community loan repayment program if our sure goal is to go back and practice primary care in a rural area? Or was the NHSC Students to Service Loan Repayment Program the best option, even though that deadline passed in the fall? So that's Mr. Acosta, and I'm going to go ahead and toss that to someone in the program to answer. Thanks.
Hi, this is Mahi Varma from NHSC. For the NHSC loan repayment programs, you have to be licensed clinician in order to be eligible to apply. As far as that's the rural community loan repayment program goes. And in terms of the scholarship aspect, if you're best suited for that, I think Sabrina would be the best person to answer that, or if Otel wants to jump in and take over as well.
This is Kelly. I just want to add a clarification that the Rural Community Loan Repayment Program does have this substance use disorder component requirement to it. So just be aware if you apply to that program that there needs to be they need to provide substance use disorder treatment. Thank you.
Okay, great, thank you. Just a quick question for both Doctors Anderson and Daywalker. Any tips? I mean, you may have provided some, but Dr. Anderson, any tips for anyone applying for these programs that you'd like to share?
Well, yeah, I think every individual is a little bit different in terms of where they're at with this process. If you, I see some of the questions that are being answered, and I think the folks from HRSA and NHSC can answer the specifics. But if you are quite positive that you want to go into one of those primary care specialties, the scholarship program is great. If you're a little uncertain, you might wait and do the loan repayment program or one of the other programs. So if you're not sure if you really want to do surgery maybe, or family medicine or internal medicine, then maybe don't do the scholarship program. But if you're really set on one of the primary care specialties, the scholarship program is a good one. But I think, yeah, think about your background, think about where you want to serve, think about what you want your life to look like potentially. And also remember that when you're in your 20s, and then when you're in your 30s, and when you're in your 40s, life circumstances change. And when people start having kids and other things, sometimes when they really want to work in the American Samoas and do their repayment, it becomes a little bit more difficult once those other family circumstances change. So just keep that in mind. I will say though, there's a lot of choices out there, so you shouldn't feel like you're going to be placed in a rural or urban site. Like, let's say if you really want an urban site, you're not going to be put in a rural site, or vice versa. There's a lot of sites out there, and a lot of opportunity to choose. And I think the goal is to find a fit for both you and the NHSC.
Right. And I'll just piggyback here really quickly to a point that Dr. Anderson made earlier, but I just want to highlight it. So my wife is also a physician, right? And one of the things that we really want to think about, especially transitioning from, really as we, get our education, do our training, a lot of it is really focused on us, right? As the medical provider, the dental provider, the nurse, whatever we're doing our primary training in. And when it's time to kind of graduate, right? And now you're looking at options and things like that, you really have to consider your partner, right? And it comes down to making some of those choices. But the really great thing about NHSC, and just to highlight this, it's not just rural, it can be urban, it's a lot of different settings, but you really want to think about it in partnership, in tandem with where your personal goals are. I think I speak for both me and Dr. Anderson here, in that we found good fits, right? That allow us to kind of grow professionally, but also too, it seems like our families enjoy where we are. So you got to really take those kind of things into consideration as well.
Thank you both so much. So we wanted to make sure that, if you have questions that have not yet been answered, or if you still have questions that you'd like to ask, we're gonna have our folks stay on for a little bit longer to make sure that you get an opportunity to do that. Go ahead and put those in the Q&A pod, and we'll continue answering questions for a little bit longer. But for the rest of you who are who joined in, we hope you found today's presentation to be relevant and valuable. We hope to see an increase in the number of MDs and DOs applying for these awards. We need you. A special thank you to our co-hosts and our presenters. And I know you'll be interested in listening to the recording if you didn't get a chance to catch everything today. So we'll send that as well as slides from the workshop and some additional resources via email next week. So we thank you so much that you've registered so we can get that information back out to you. As we close, just take a quick peek at this last slide. Our HRSA, which is our Health Resources and Services Administration, that's the umbrella organization for these programs, is on 5 social media platforms. And we encourage you to follow along, share our content on X, Facebook, LinkedIn, Instagram, and of course, stay up to date with our news. Our account handle is at hrsa.gov or at hrsa.gov. And you can also visit our YouTube page. We have lots of great information there. You'll also see a link in the chat to sign up for our e-news, which will give you a bi-weekly email compilation of the most comprehensive news across the entire organization, as well as our press releases. Once again, I thank you for joining us today, and I hope you have a wonderful rest of the day. Hello, I see there's still some attendees and our Q&A pod is still open and available for the next few minutes. So if you're still on and you have a question that hasn't been answered or you have a new question, please go ahead and submit that and we will make sure to respond. Thank you. Hi, Dr. Daywalker. I think there was a question that came through for you. You still on? I think I saw you still on.
I'm here.
Okay. How did you locate your site where your facility is? Did you get assistance from the program or our regional offices or the Health Workforce Connector? Like, what was the path you took, if you can recall?
I use a combination of things, honestly. I leverage the Health Workforce Connector. Also, with my residency, we brought a few speakers to kind of come and help us with like placement for jobs and things like that. And one of the people that came was a representative from TAC, which is the Texas Association for Community Health Centers, which is the primary care association for the state of Texas. And every state has a PCA, right? A PCA again is the
Primary Care Association?
yeah, they're like the leadership and governance of a state's community health centers. So they had a recruiter come. So she worked with me as well. The ultimate decider though was my wife, right? So she did her own research and said, you know what, I can see myself being here while I finish this up and all this other stuff. So really, I really use a few different things. So there's a lot of tools out there. I'm sure that Sharon, y'all probably got tons of stuff you guys can already share with them. I'll share what I have, but yeah, there's a lot of things that kind of help you locate the site. And then also too, once you graduate, if I remember correctly, you start to work with someone, I can't recall their official title, but it's someone that kind of helps you with placement as well. So you're going to have a lot of different resources at your fingertips.
Thank you. I so appreciate you sharing that with us. That's very helpful. All right, I think we're at a point where we have no more questions coming in. And we're going to go ahead and formally close the event. Thank you all so very much, all of our co-hosts, our presenters, and of course, all of our attendees for joining us today. Have a great rest of your day.
Thank you.
Thank you.
Thank you. Bye-bye.